Welcome to another episode from the Veterinary Research Channel. Today, we're diving into a compelling discussion surrounding the treatment of benign ureteral obstruction in cats, a common and challenging condition in veterinary medicine. Our focus is a letter to the editor regarding an article published in the Journal of Veterinary Internal Medicine, which explored the outcomes of medical management for this specific condition. This letter raises important points about the perceived standard of care, potential complications, and alternative surgical techniques. Understanding benign ureteral obstruction. Benign ureteral obstruction in cats occurs when the ureter, the tube that carries urine from the kidney to the bladder, becomes blocked due to non-cancerous causes. These causes can include urolithiasis, the presence of stones in the urinary tract; pyonephrosis, an infection within the kidney that leads to pus accumulation; stricture, a narrowing of the ureter. The central debate: medical versus surgical management. The original article in question suggests that medical management of benign ureteral obstruction in cats has a higher success rate than previously thought, presenting it as a viable option for owners who might decline surgical interventions. However, the authors of this letter challenge the assertion that subcutaneous ureteral bypass, or SUB, device placement is the gold standard, arguing this statement is misleading. Examining subcutaneous ureteral bypass (SUB) devices. A subdevice is a surgically implanted system designed to bypass a ureteral obstruction, providing an alternative route for urine to flow from the kidney to the bladder. The original article cites studies that report high hospital discharge rates, up to 94%, and median survival times between 821 and 827 days with SUB device placement. However, the letter's authors point out that these studies also reveal significant complication rates. Complications associated with SUB devices. The letter brings attention to a range of complications associated with SUB devices, including device kinking. The SUB device can bend or kink, obstructing urine flow. Reported rates range from 3% to 10%. Luminal mineralization. Minerals can deposit within the device, narrowing or blocking its passage. This occurs in 17% to 25% of cases. Chronic infection. The presence of a foreign body like a SUB device can increase the risk of persistent urinary tract infections. Studies report rates between 24% and 25%. Non-infectious cystitis. Inflammation of the bladder not caused by infection, occurring in 9 to 38% of cases. Urinary tract infection. UTI infection in the urinary tract with rates between 20.8% and 35.7%. Postoperative bacteriuria. The presence of bacteria in the urine after surgery, with rates up to 36%. Overall complication rates are cited as high as 88%, though more commonly around 48% to 56%. Revision surgery, to address these and other issues, may be needed in 8% to 27% of cases. In rare instances, transmural migration of the device into the digestive tract has been reported, requiring a second surgery. An alternative perspective: the role of natural tissue repair. The authors of the letter advocate for the use of natural tissues to repair ureteral obstructions whenever possible. Drawing a parallel to human medicine, they note that ureteral bypass devices are often reserved for end-stage cases due to the high morbidity associated with permanent implants. They emphasize that the small size of feline ureters requires specialized training in microsurgery, including the use of magnification. With proper training and technique, complications like leakage and stricture can be minimized. While the learning curve for microsurgery is steeper than SUB device placement, the authors assert it is achievable with appropriate training. Challenging claims of high complication rates with standard surgical techniques. The letter also disputes the original article's claims of high complication, mortality, and recurrence rates associated with standard surgical techniques. They cite a study by Wormser et al., where intraoperative magnification was used during ureteral surgeries, resulting in a perioperative complication rate of just 3%. Survival to discharge was 92%, and the median survival time was 1,519 days, significantly longer than reported for SUB placement. Addressing reobstruction rates. The authors of the letter clarify that the reobstruction rate of 22% to 40% mentioned in the original article is misleading. They explain that this rate combines both medically and surgically managed cases. A closer look at the data reveals that the incidence of ipsilateral reobstruction after ureterotomy, surgical incision of the ureter, was actually around 20%. The need for revision surgery in the cited studies ranged from 10% to 13%. Long-term management and financial considerations. The letter emphasizes the long-term financial commitment associated with SUB devices. Current recommendations include regular irrigation of the device, adding to the ongoing cost of managing cats with chronic kidney disease. The authors point out that limited information exists regarding the full financial burden of SUB device management, pain management, and quality of life. Drawing from human medicine, the authors highlight the considerable pain and discomfort associated with ureteral stones. They suggest that pain management should be a key consideration when making treatment recommendations for cats with ureteral obstructions. While objective pain assessment in cats with ureteral stones remains a clinical challenge, it should be assumed that these patients are likely experiencing pain. Conclusion: a balanced approach. The authors conclude that while SUB devices can be a reasonable palliative option in certain cases, the use of natural tissue repair should always be prioritized. Given that standard surgical options and SUB placement appear to have similar survival to discharge and reobstruction rates, and considering the higher rates of infection and revision surgery associated with SUB devices, the statement that SUB device placement is the standard of care is not justified. The letter highlights the importance of carefully evaluating the available evidence, considering all treatment options, and tailoring the approach to the individual patient. The decision between medical management, SUB device placement, and traditional surgical techniques should be made in consultation with a veterinarian, taking into account the specific cause of the obstruction, the patient's overall health, and the owner's financial capabilities. Thank you for listening to the Veterinary Research Channel. A link for the reference paper is in the video description. Remember to test your knowledge by answering the questions in the description, and as always, keep those minds inspired, hearts light, and tails wagging.